Hello and welcome to my YouTube channel. Appreciation to those of us that have subscribed so far, and if you haven't, hopefully you will do so before you shut down. Today I'll be speaking concerning a condition called obstructive sleep apnea. Obstructive sleep apnea. So from those words, obstruction or obstructive means blockade. Sleep occurs during sleep. Apnea means to stop breathing. Now, what you may not be aware, we may assume that everybody keeps breathing in the course of sleep. Not exactly true, as you will see in this topic. This condition typically will occur in a patient that is either overweight or obese. Now, the body mass index is the relationship between your height and your weight, and it's very important in telling us certain conditions that people could be predisposed to. Now, if you want to calculate your body mass index, all you need to do is to calculate your weight in kilograms and then your height in meters. Now, the weight over your height in meters squared. In other words, if your weight is, say, 70 and your height is 1 meter, you say 70 divided by 1 times 1. In other words, your height squared. Now, if you don't want to go through all that, you could just put in body mass index calculator on Google, and it will bring out a calculator that you can use. If your body mass index is greater than 24.9, then you are overweight or obese. This condition will occur in people that are obese, say greater than 35 in body mass index, more likely to occur in males than females, more likely to occur as we get older, greater than 50 years, more likely to occur in smokers, those who drink alcohol, and those who have a large tonsil or adenoids. Tonsil, adenoids, these are soft tissue structures in the neck. This condition occurs during sleep. Now, what we need to understand is that as we put on weight, we also develop a large neck circumference. And at the end of the day, when you have excessive parapharyngeal or neck tissue, in the course of sleep, there is relaxation of the throat muscles. You can also call it pharyngeal, throat muscles. And that tends to close or narrow the airway to the point where you wake up repeatedly because of the fact that you stop breathing. Now, let's break it down a little bit. If for a reason the neck muscles relax and they close the airway, so for a period of some seconds in the course of sleep, you will stop breathing. And when you stop breathing, the oxygen level in your blood will nosedive. It will become low, and the carbon dioxide will increase. And when that happens, it will trigger the stimulus, and then you wake up and then breathe again, change position in bed, and then continue sleeping. But after a while, it will occur, the same process will occur again, to the point where you have repeated stopping of your breath and then breathing again, waking, stopping of. So you have that cycle play out again and again until morning. Now, that has its own implications, as we'll see. Now, what are the symptoms to look out for in a patient that has obstructive sleep apnea? Number one, loud snoring. Usually, your spouse would either have complained or have noticed that you sleep and snore very loudly. And that's a very, very important sign or symptom that you do have obstructive sleep apnea. Number two, daytime sleepiness. In the course of the day, if you've slept well, you should be able to go through the day without feeling excessively sleepy. But in this patient, because of the repeated waking and sleeping and waking, stopping of your breath, waking up to get some air, when you wake up in the morning, you think you've slept, but in the course of the day, you feel excessively sleepy. And that's one of the very important symptoms. Also, because of the fact that you didn't sleep properly, you feel tired, fatigue from poor sleep, poor concentration. And then because of that excessive daytime sleepiness, sometimes that is the reason why some people have accidents, because of daytime sleepiness. They're on the steering, they think that they are driving, and then because of the excessive pressure to sleep, so to speak, The person slips off momentarily and then veers off the road and causes an accident. And then, number 6, hypertension. What does your doctor do? Your doctor should refer you to a pulmonologist, as a chest physician, or a specialist sleep clinic where you'll be evaluated for obstructive sleep apnea syndrome. What are the measures that we can take in managing this condition? Number 1, and this is so important, is to stop driving. Depending on the country you are in, you may need to inform the driving authority. But what is really important is to stop driving, because you are risking your life and the life of others on the road if you continue driving and you are experiencing the symptoms I've mentioned so far. Number 2, rather than sleep on your back, you should sleep on your side. By sleeping on your side, you will reduce the tendency for the airway to close. Number 3, we've said that one of the major reasons why patients or people will develop obstructive sleep apnea syndrome is weight or excessive weight. So if you notice that your body mass index is overweight or obese, then please take steps to lose weight and engage in exercise. Number 4, stop smoking. Number 5, reduce or preferably stop drinking alcohol. Number 6, because of the association with high blood pressure, you may need to be on antihypertensives. Number 7, there is a machine called the cpap machine that can be given to you to enable you breathe better by preventing narrowing or closure of the airway while you sleep. And then number 8, if the problem is because of the adenoids or the tonsils that are enlarged, then that will require a surgical approach. So we've talked about obstructive sleep apnea, a condition that occurs in the course of sleep where patients stop breathing for some seconds, wake up intermittently to get some air, and at the end of the day, they wake up in the morning feeling unrefreshed, with daytime sleepiness, fatigue, poor concentration, and at risk of road traffic accident. If you've learned something, please do well to subscribe before you leave, and also feel free to share. Thank you very much, and see you next time.